Hello ladies, we're going to today talk about a thing that is an occurrence that is not a complication, but it's an aesthetic outcome, and it's fairly significant, so we want everyone to understand it from this way. So let's think about this for half a tip. When we're going underneath the muscle, we're talking about the pectoral muscle, which is a large band of fibers which are on your chest and go back up to the shoulder here and down to the breastbone. Now we're putting an implant underneath that muscle, okay? Now, doing properly, we also go underneath the muscle across here. And why do we do this? Because we get a good support down here. Now, we are then, if you see, lifting that muscle off the chest. Explains why it's more painful, takes longer to recover. So the natural course here is that if we've lifted this muscle, that muscle allows the implant to roll up. The action of the movement pushes the implant up. That's why we strongly advise you to do the rolling, to roll the implant in here so it comes out here and descends down into the bottom of the pocket. Now we also ask you to wear that white strap, which helps push down as well too from that side. Now, the great majority of time, there's never a problem. However, you can get failure to descend. And this gives you the breast that stays high up. Now, sometimes it's actually irregular, so one is different to the other in the descent. How often does this occur? Less than about 1% of people get this. Okay? Who is it most likely to occur in? Obviously the people with stronger chests, people who don't follow instructions, and if you go bigger, obviously it's going to occur. Can we predict it? Well, we tell some people that if you go bigger, and in the consults we always say, bigger implant, bigger problems, more chance that you'll get complications or aesthetic unacceptable, may redo surgery from this way. So, do smoking affect this? Uncertain, but possibly from that way. We have looked at our aesthetic outcomes, and remember some studies are up to 3 to 15% of people after implants will have aesthetically unacceptable outcome. We're running at 4%. Now, of those 4%, 80% of those people are smokers, so we're not sure, but it's an issue back from that side. Now, we're in contact with you, we're guiding you from that way, and this here, if it's developing, we ask you to increasingly roll and pressure, increasingly wearing the white strap, and you just have to know that sometimes the muscle will not reattach, and we said this is an issue that can occur, especially the bigger the implant, the more likelihood this won't go. Worst case scenario, the implant rolls up underneath the shoulder from that way. So we always tell you that even though 80% of women will wish they'd gone bigger, if you can keep the implants to smaller sizes, you're going to have less issues and dramas with this. Now, if it does occur, what can happen is you can develop scarring and healing at the bottom of the implant. Remember, when we do the surgery, we sit you up. We lower the pocket so the nipples are regular and your breasts are sitting in the place that we want them to be at surgery. There is a pocket there. So is it our issue if you leave and it rolls up and won't come down? No, but are we concerned? Yes. What do? We work with you. Usually, if it has over a long period of time failed to set, and remember we say 6 to 16 weeks, so that is up to 4 months before we'll see if it's really coming down. If it's failing to come down, we can get you back. You understand there's costs involved because we've explained this to you in the consultation process, the consents, but we'll try and push the cost down. We have to pay. The theatre costs approximately $1,000 an hour. Usually it's about $1,500 with all the other carry-ons. If we have to replace implants, they're further again. So if we have to bring you back, I'll try and push the cost down. Remember, that's for the theatre costs and the staff. That's not for me. I will do this to try and help you. If you come in and it was someone else's work to treat failure to descend, I'll charge you the $4,000 to $5,000, which is market value. So what do? We have to go in, we have to break down any of this scarring here to lower the implant down and be aggressive to try and hold up here. Will this work in 100% of the time? No one can guarantee, but this is the treatment to go back from that side. Now, the other thing that can occur here is that when we're looking at bringing implants down, and sometimes even if implants are good at themselves, you can find the implants bottom out. So rather than the breast sitting nicely here at the crease, over time what happens, there's a dropping of this skin, so the implant now lowers here and goes into the fold, or alternatively, the scar is here and the implant opens up the bottom of that pocket so it goes lower from that side. This bottoming here, where the scar stays attached to the skin at the right place, excuse me, is usually an above muscle implant, but still can occur. Why does it occur? Don't know. Big ego, obviously the issue, but can occur in some people. Not everyone, we can't predict it. If it happens, sometimes the only solution is changing implants. If it bottoms then stays stable, we can put a larger implant in to give you more fullness at the top, but this has a greater weight and sometimes lead to sagging of the breast. The treatment here is we need to open up the wound, we need to go in, and we need to suture this back to hold it on position. We have issues then that we're maybe flattening the resuture. We're not sure it holds because even though we try and use very good sutures and technique, you have the issue of it's your body's healing that's allowed this to open up. How do we know it won't do it again? So these things are possible. So we're looking at here both failure to descend and bottoming both between the nipple and the crease, or the crease being lowered. These things occur in combination with failure to descend maybe 2-ish% of the time, 2.5%. Not common, but they're still there. We tell you about the consultations, we hope they don't, and we work very hard. If they do occur, we need to know, you need to work with us. We'll try and get the cost down as low enough to treat, but remembering, at the surgery, there's a position of your breast in the positioning, looking good straight after surgery from that side. Then the issue is healing after from that side. So talk to us, come to us early. Attacking on social media, complaining won't help us help you. It drives our costs up and then we can't help other people. So these problems do occur. If they scare you, if you don't ever want to get them and you're worried about the 2% or so of people that do, don't do the surgery. Everyone internationally gets these no matter how they've got to do them. If you do 20 to 30 cases a year, you may never see them. If you do 500, which we do, you'll have some people see from that way. So I hope this information helps. And again, I want to help everyone who has the problems with their breasts. So we're happy to talk to you, but be aware these things can happen. They're not common, but you need to know about them. Hope that helps. Bye.